Our countdown to pink continues as we inch closer to Breast Cancer Awareness Month. We're talking about options for those undergoing treatment. Dr. Diulus is joining us now from the Crystal Clinic. Thank you for being here.
Oh, my pleasure. Always
it's good
great
to see you. Love
again.
seeing you. And now I get to see you twice in 1 year instead of just once.
The best.
We'll get to the wonderful event that the Crystal Clinic does in a moment. First, though, talking about reconstructive surgery. It's pretty common when it comes to breast cancer, correct?
Yes. All women, by law, have to be offered reconstruction. So it's very common, very common.
And when it comes to the different options, could you go through some of them? Like, what are the options that women have?
So I always tell women when I'm educating them on breast reconstruction, first we have to see, are they going to have what's called breast conservation? A lot of times we're not involved with that. It's where they're just removing the cancer itself. A lot of times those patients have radiation afterwards. Sometimes we're involved where we're actually reshaping the breast with that. But otherwise, you can have either an implant-based reconstruction or using your own tissue, whether it's your belly, your thighs, things like that. So we have a lot of options for reconstructive of the breast.
And I know that you might have women who have already had reconstructive surgery, but for one reason or another, they come to you because their reconstructive surgery didn't go as they would have liked. So do you see a lot of revisions then?
We do. That's the good thing about our expertise is we do see a lot of those revisions. So patients that just aren't satisfied, and there's a number of reasons that they wouldn't be satisfied. So one, we were talking about the breast conservation, where the patients had a portion of their breast removed. Sometimes the shape of the breast afterwards just doesn't look right. They can have some asymmetry between the other breast, and they're just not happy. They don't feel comfortable in clothes. And we have options to help them kind of make themselves, again, feel comfortable with what we can do. So that's one option, again, for breast conservation. It's a little complex because they've had radiation, so just putting an implant in there is not an option. So we usually have to use your own tissues for that. Other options, I'd say, is some patients come in with pain after the reconstruction, and it can be devastating, life devastating, where every day they're feeling that discomfort. And a lot of times we're able to diagnose something called an neuroma, which is a little nerve that gets cut. That's why a lot of women don't have sensations, because those nerves get cut, and that nerve doesn't behave, and it can form scar tissue and lead to a lot of discomfort. And we can actually do surgery to help relieve that pain, and just the quality of life improvement when they're not in pain every single day. It's great.
It's heartbreaking to think that women, after already going through so much, have to then experience something like that. But that's what you're there for. And I think oftentimes it's not remembered that insurance would still continue to cover these things, correct?
For the rest of their life. Again, when we do an implant-based reconstruction, that implant, it's a foreign body. It doesn't last forever. It can rupture. It can have complications with it. And again, that's what we're here for. We're here to help fix those complications, help fix that implant that doesn't work after a while.
And you've seen it firsthand how their quality of life changes drastically after these surgeries.
It's amazing. It's amazing. The smiles we get on their faces, bringing them back. Again, most devastating diagnosis of your life to, again, feeling whole and complete. It's just fantastic.
And I know that once a year you get to see the hard work that goes into this pay off when these women walk that pink runway, October 23rd this year. It is honestly just an honor to be part of it, to see the smiles on their faces, to see the confidence that you guys have given them back.
Again, it's a beautiful night. I cry every year just seeing the joy on their faces. And I feel privileged that these women have chosen Crystal Clinic to make them complete again. It's just great that that they've made that choice to come to us to help bring some completion to their journey.
Well, you have to see it for yourself. Again, I love being a part of this wonderful event. They will strut their stuff down that pink runway, and you can be there to cheer them on through the process. And it is just so wonderful, again, that the Crystal Clinic is there in those times of need. And you shouldn't be afraid to ask, right? Because this can make you whole once again. Whether it's the side that was not affected, you can still adjust things to make them
100%. So again,
the best they can be.
Another reason that we have revision, so is asymmetry. So sometimes, again, the reconstructed breast, now it's in a great position, but you might have a ptotic where your breast where it's low, and we have to improve that shape of that breast to make you match the other breast, so again, you're feeling comfortable.
They really do. They'll help you through every step of the way. Every single patient that I've seen at these pink runways raves about the team of doctors there and the staff, and I've witnessed it now firsthand too. It has been such a pleasure to work with you guys. Can't wait to see you October 23rd.
I can't wait as well.
We're going pink on the pink runway. Thank you, Dr. Diulus.
Thank you so much for having us.